there is nothing magical about moving too quickly. You can still do your job well in a paced way that doesn't sacrifice the time you spend with people, the time you spend at home. I mean, I sit back and reflect that I didn't do any travel between college and grad school and getting into my career. And so I wish I'd had those moments to explore before the responsibilities of life, show up.
Yeah.
And also now that I'm 39, about to be 40 this year, I don't know what's next.
Welcome back to Stepwise, a series of important conversations with talented leaders about their insights, journeys, and approaches. Look, it's settled research in 2025 that leadership matters to performance and it matters to people. I believe that a core tenet of leading at one's best relates to our bringing forth our wisdom, our best thinking, our knowledge, our experiences and insights to address the complex problems of today. One way to do that is to learn from great leaders like today's guest, Roberta Tinch. Roberta is a seasoned healthcare executive in Virginia, part of the Inova Health System. Her detailed bio will be contained in the interview. From my time with Roberta, you'll learn, while a calm and very relational style may seem at odds with high standards and accountability, make no mistake, they are not, and she's got those two things nailed. Also, you'll learn Roberta's secret, her presence, so she can deeply connect, understand fully, and build commitment to tackle the most challenging issues she and her team faces. And passion, a critical element of great leading. You don't have to jump up and down to have it and to demonstrate it. Just watch Roberta. Please enjoy my conversation with Roberta Tinch.
Welcome, Roberta Tinch.
Thank you.
Lovely to meet you, and thank you for taking time with me today to explore these issues about leading in today's world. You are Senior Vice President for Inova Health. I believe you are president of a service line on musculoskeletal. Is that still accurate?
I'm the president of the hospital, and then I'm vice president of the service line.
Got it. Okay. Excellent. Boy, that's a healthcare thing. You're also very active in your community. You serve as chair or vice chair for a number of nonprofits, including Mount Vernon Chamber of Commerce, Families Forward Virginia, Northern Virginia Urban League. And now I'd love to, have you fill in who is Roberta?
I am a Richmond, Virginia native, born and raised, and a daughter of healthcare leaders. I'm pretty sure I was hanging around the unit cutting up since I was like 2 or 3 years old, and that's okay. So my mom's a nurse of over 40 years,
wow.
and
Wow.
My dad, he had some kidney transplants in when I was younger. And that's an important framework for me because I've always been in hospitals and I always saw the tension points of hospitals and nurses and patients. And, you just see it. You don't really put a name to it or a why to it. You just experience it, which is fine. But then I realized later on, you reflect on how did I get here? How did I become a leader in healthcare? You start going back to those early moments in time and realizing that was a seed. That was a seed. And I cannot remember ever wanting to do anything else other than healthcare. I thought I'd be a physician, but some things are not your path or your passion. But my passion was in leadership, and I found that in college. Decided to pursue a master's in health administration, and packed my bags and headed to Denver, Colorado, where I got my first job as a healthcare administrator, junior administrator, 23 years old, and just kind of jumped in.
So to that point, on leadership in Denver, Colorado, I'd love to read a quote about you from one of your leaders at that time.
Okay.
Here's what it says. This is from a friend, John Hill, an associate who has connected us. Roberta is an excellent operational and intuitive leader, making her one of the most adaptable leaders I've worked with during my career. She's a values-driven leader with an exceptional talent to work with people. Her excellent communication and charismatic interpersonal skills immediately draws people to her leadership. The authentic magnetism of people is strengthened and respected by her commitment to gain and keep the trust of those she serves. She's equally effective working with caregivers, physicians, and community members. That's quite a testimony.
I'm speechless, and I'm so grateful to hear that, and humbled to hear that from John. John Hill was my first boss, and sometimes you think, okay, a boss is going to give you the projects, the assessment, the next project, the assessment. But I realized early on that I found a mentor in John. Then I found a sponsor in John, and ultimately, after he and I no longer working, I found a friend. A lot of who I became as a healthcare leader was shaped through his mentorship, and I continue to, value culture, value people. Um, we don't get anything done in this world without relationships.
Kind of given all the existential threats in healthcare that healthcare leaders today face, how are you holding up? Like is what's required for you to show up fully and powerfully every day as a leader to all the people that you're charged with, is that different than it's been in the past?
So much different. As the industry has changed, not only have I changed and grown as a leader, you change outside of work. Your personal preferences change, and you have to figure out how to balance what's happening in your life with your work. I would say 10, 15 years ago, I thought I could just throw myself in the work and the rest will take care of itself. And I've learned the word flexibility and adaptability and input those in my life. Self-care is real. Pausing is real. Delegation is also real. So those are things. I mean, how you handle it is, I think you have to step back and pause. And I found myself personally just overwhelmed with the next meeting, then the next meeting, and not being able to really sit down and think, what have I just, consumed by way of meetings earlier in the day? What do I need to pause and think and lead my organization, not just short term, but long term? What are we working on this year? And then how am I? Like, am I in a comfortable, peaceful, serene space where I can say my head is clear and I'm not, not too disoriented. And so once I started, working with people around me and say, okay, let's reset. I think I find myself doing things that is really within your scope of responsibility. So let's figure out how we manage that accountability. I think we used to honor years ago,
Yeah.
the badge of, oh, I worked really hard. I worked a lot of hours. I was here till 8 p.m. There's this bravado, a sense of accomplishment for the length of time you worked.
Yeah.
Who knew if it was quality? Now I sit down and I have the team around me, and I'm like, block out time on my calendar, and that time is blocked for the rest of the year, for planning, for rounding, for me to reconnect with the team members, to wander down the hall and talk to my team as well.
Yeah.
And I literally sit there with a piece of paper and write out, okay, what's important, what are the strategies for the organization, where are we, what do we need to do, what do I think about it, and then I take that to the team. We have this two-way conversation, and being able to do that has definitely helped me show up with all this change and not be reactive to it, but think long term.
I was just reviewing a conversation I had with Bill George. One of the points he makes so powerfully is that leaders today absolutely mandatorily required time for reflection and deep reflection. And if you don't get that, you can't be clear. And if you can't be clear, you can't lead your workforce, especially given all of the changes. So I love what you just said. So I'd love to stay there. Like, given all the many things going on, multi-generations in the workforce, increased agency of the people in our workforce, the incivility, divisiveness that we've seen, geopolitics, all of that stuff. When you think about the people you lead or the people in your organizations, what are the factors, I guess maybe external, but some of those are personal as well. What are the factors that are most affecting them? What are you seeing, and how do you experience those impacts?
Oh, the first factor is economic. This I need to be able to afford my life, my house outside of work. I need to be able to manage childcare. Those were topics that hit my organization really hard in 2021. People bring that to work. They bring those stresses of needing more pay, needing flexibility in the work so they can get home to take care of their child, like all of the things. And then they're also bringing parents with them into their homes. So their homes are now becoming multi-generational. So not only am I thinking about how I care for my child, how I try to keep myself, in a position well, I'm also thinking about what's happening with my parents. And so, of course, we've got all the generations, right? They're shifting, not just in the hospital where we say the generations are aging, they're happening to us personally as well. You have to rally around your team and go see them where they are, just so you can say, I see you where you are.
Yeah.
You're not just only getting an email or a, by the way, feel good, or out of touch communication. That there's nothing worse than a communication that's out of touch with what your people are actually feeling. And where I am not present, I always check in with the team. How is your team doing? What are you hearing? I even ask my medical staff director, how are the physicians doing? To get that temperature, because they're also going to they talk with the team and they talk with their peers. So if you're not in it, how do you keep your pulse on the organization? So we've made investments in average hourly wages. We've looked at PTO and all of the fringe benefits that come around with the economics. Sometimes it's not directly in your pocketbook, but it's offset by a benefit. We've had a very intentional focus on conversation, actually.
Excellent.
How do we ensure that we're doing leader rounding and we're doing one-on-one conversations with team members? And these concepts aren't new, so it's not like we're reinventing how to stay connected with your team members. That's not really it. It's the intentionality and the quality of the conversation.
I love your point about kind of intentionality. To me, commitment to people is shown in that second question or the third question, and truly regarding, truly listening to their responses to it. Yeah. You're like, how are you doing? Oh, no, really. How are you doing? And what's next? And how can I support you? And, what about your father? Or what about, I love that. There's a wonderful quote I heard recently. It's probably not new. When Satya Nadella took over Microsoft from Steve Ballmer, he said he evaluated the culture at Microsoft and said, we are a culture of know-it-alls. I want us to be a culture of learn-it-alls. Yeah. And I thought, wow, how simple but profound that is. If we ask the question, if we truly regard and truly connect, we're learning, we're growing, we're more agile as an organization, we're stronger, all that stuff. But it's hard for us to do. Really hard for us to do.
We have to start modeling it. We have to start modeling it.
We do. Oh, for sure.
Right?
For sure.
I have a great time with my team here in the administrative executive suite and also across my peers across the system. As we bond and laugh and joke and have this relationship, others are looking to us and like, oh, we could do that too. And then there's this beautiful trickle-down effect that happens throughout the organization when you model the behavior you like to see.
With all of the challenges in the workplace, including safety, including viability, economic viability, including all the challenges that people are feeling and bringing into the workplace, how do you help others on their growth journeys?
I think helping people on their growth journey is also knowing who you can call and knowing that they'd be willing to call you. When they have hey, I'm thinking about this, or I'm in a tough position. Say, hey, I'm here to take feedback. Like, first of all, let me model that if you have feedback for me, just call me. So I modeled that first. And then when they ask, hey, can I get some feedback? What I'm thinking about, they'll call you back for their own journey.
Well, if I might, it sounds also like you've earned the right to ask those questions and that people feel safe in responding to you because you connect with them first. You are relational. Do I have that right?
Yeah, I would say that. And I'm an advocate, and I keep your confidence.
That's a great playbook by itself.
Mm-hmm.
Yeah. So this may be a bit redundant. So what's your superpower when leading other people? What's your
Being able to advocate for people, build
hmm,
relationships with people in
hmm,
order to create value for the organization. I don't have a technical background, and so the ability to lead a highly technical organization, which is a hospital of all different skill sets.
yeah,
I think that is indeed a superpower to be a
I would think
non-clinician
so.
to lead a clinical
Yeah.
organization.
How does a leader today develop the kind of relationships with people to manage that collision between organizational needs and human needs?
Yeah.
I'm struck by this thing. I have three kids, 41 down to 31, and there's an expression they use all the time. As opposed, it's kind of indirect to me, but I get it. It's like, and they're not wrong. You know, the people that aren't working 24 hours a
Hmm.
day and want balance, and they're not wrong.
No.
You know, the people that need a little bit more money because they're caring for their parents, and they're not wrong. And we've got so many of these, and they're not wrong moments.
Wow.
And you know, it's like so that's the premise, and it sounds like
That's a good
who
one.
you are, who you are as a leader. You connect, you listen, you empower, you stand with, are all so vital to your success. It sounds like.
Thank you. And I will tell you the other side of that. I am very clear on what I expect. Very, very clear. And the team gets that from me from the beginning.
Yeah.
Because as I mentioned, when you take that time to look at your results that you've accomplished with respect to the organizational goals, if you're part of a system with regards to the system's organizational
Yeah.
goals, where do you stand? What went well? What were the opportunities? Okay, you assess. Now you're able to go back to the beginning of the year and say, hey, I've reflected on
Mm.
the amazing work we've done, and congratulations. And I've also reflected and inquired as to what do we believe may
Yeah.
be opportunities. Well, let me start with, and I've said this, I start with you are the leaders of the people. We're in the
Mm.
people business. We work through, with, for people. So it's not just this relationship one-on-one. There's a whole 360 of relationships that every person at every level has to be able to embody in the pursuit of excellent care. So let's talk about our goals. Patients, team member turnover, revenue, growth, just quality metrics, value, through all the things. Let's talk about what those things mean to a person, to a patient, to an organization. And I create a story and give it visibility.
You know, that speaks to this other boundary. This leading in these times just isn't about loving up people more and treating them better. It's also about balancing real organizational needs,
Yeah.
and being a fierce advocate for those when it would be so easy to let standards slide, for example.
Yes.
We don't have the ability in healthcare, especially, to let standards slide ever.
Nope.
And interesting. So here's a personal question. What's the leadership lesson that you really get today that you wish the younger Roberta knew earlier in her career?
You don't have to move so fast.
Oh, brilliant. That's brilliant.
There's this, I gotta go. I gotta achieve within. I mean, I told myself, like, I'm a very goal oriented person. 22, I entered graduate school, and I said, you know what? I'm going to be a CEO by the time I'm 30.
Hmm.
I don't know where I thought or how I thought that was going to
Yeah,
happen. It just
yeah.
seemed it could happen, right? Like, why can't I be a CEO in
Why
8 years,
not?
coming from the classroom to leading someone's hospital? And I moved very quickly through my career. The blessing is I've had a wonderful, wonderful career. To achieve CEO by 34. I mean, I'm off by a couple years, Foster, but I'm still happy that
Yeah, no kidding. Congratulations. I mean, that's still an
It,
incredible arc.
it's still something I'm very proud of. But then I also realized there was nothing magical about moving too quickly.
Mm,
You can still do your job well in a paced way that
mm,
doesn't sacrifice the time you spend with people, the time you spend at home. I mean, I sit back and reflect that I didn't do any travel between college and grad school and getting into my career. And so I wish I'd
mhm.
had those moments to explore before the responsibilities of life, show up.
Yeah, yeah.
And also now that I'm 39, about to be 40 this year, I don't know what's next
Mm,
because, and I've had this conversation with my peers. I'm like, I have several colleagues who are CEOs and COOs between the ages of 38 and 42
mm,
in major systems, large facilities. And we're all kind of like, huh,
mm.
we've been doing this for almost 20 years.
Wow.
What's next? And it's a very um, weird place to be because for once in my life, there isn't a next step.
You talk about, and I love the word intentional. You talk about intentionality in interactions with people, in my opinion, requires a degree of presence in addition to that purpose. Because you could say, I really want to really show great empathy and regard for people, but be so busy and focused on the next meeting, that's going to start in 5 minutes, that we lose that moment. So this is kind of a funny question, but I'd love you to weigh in on it. Like, what's the role of awareness, or dare I say consciousness, on the part of organizations and its leaders today in helping adapt to these times with increased needs of our workforce?
If you're not present and aware of what is either right in front of you or happening throughout your organization, you're leading at a deficit.
Mm,
You're going to make decisions or even make commentary or assessments around what you believe is the culture or the problem or the goal, but you really don't have full awareness of it because you didn't either hear it, because you're partially hearing it. The intentionality of turning your phone over in a meeting, pushing it aside, leaning into a conversation so someone knows that you are focused and you're listening to them, making sure if you have your phone in your hand, put it in your pocket when you're walking through the hallways. If you are walking through the organization, walking to the hallway, people see you, but you don't see them.
yeah.
It's like walking past, trash on the floor, and you're like, I'm sorry, I didn't see it.
Yeah.
And reflect on the other side of that. If I'm the person who's not seen,
Mm. Oh boy. Yeah.
what that means to the organization, the unintentional message that you send. Also, being aware when you're in different parts of the organization, sitting back and just saying, oh, I heard this group has this perspective on the topic and this group has that perspective on the topic. Why are they different? Where are they the same? Because also to
Mm.
lead, you have to find commonalities and a common purpose when people are at different ends of what we're trying to accomplish here. I encounter this a lot with surgeons, right? Like
Sure.
surgeons would have a perspective on what and how they believe their workspace should operate and how it should flow and the things they believe they need. I
Mm.
recall when I joined the organization in 2019, listening and sat down and did a road show with all of the physicians that were not only in positions of named authority, but
Informal leaders.
informal leaders. Yes.
Yeah, yeah, yeah. Of course.
People like that, people that the staff will listen to, even if they don't get, you know, a check from us or they're not in a certain meeting, like, oh, I heard Dr. Such and such said. And so then I started realizing who the informal leaders were and realizing how people in my organization responded to them. I recall a surgeon saying, orthopedic surgery is going to move outpatient. It's going to move
Mm.
outpatient. And at that time, would you say most of our patients were getting their care inside the building in a normal hospital-based setting? And I thought, okay, I hear you. And he kept saying it.
Mm.
So that was September. And I heard him. And when we went to our October, November budget, I said to my boss, I need capital to upgrade my ORs because I don't quite have an, ambulatory care setting for surgery centers. Like I don't quite have that flow. So I'm going to need the capital to make the adjustments because this doctor keeps telling me something's shifting. And I learned that as a young administrator as well. Listen to your doctors. They will tell you where the market is going. They will tell you where the industry is going. 2020, the pandemic required all of us to shift our way of thinking. And guess what? Those surgeries went to an outpatient setting and did not come back because you're aware and you're in tune and you research and you follow. But if you're just passively listening, you lose those moments.
It's interesting. Something that hadn't crystallized like this for me until you just said this. So that awareness or presence allows you to be curious. It allows you to listen differently.
Mm-hmm.
It also allows you to ask the right kind of questions. And in a changing world, and not just workforce, but strategically in healthcare, that adaptiveness, that flexibility, that agility is really, really vital.
And what would it take?
Right?
I'm hearing you. What would it take? Tell me more.
Yeah. Wow. It strikes me too, though, Roberta, that also requires on the part of the leader a great deal of self-confidence to be able to open, like, oh, I can't ask a surgeon that or a physician that because they're going to want the world, and I don't want to argue with them, or I don't want to be beholden to them. Yeah, interesting.
I don't know. Another one of our physician presidents said, "Where does that confidence come from?" He said, "You have a lot of confidence. Where does it come from?" I was like, "I have no idea." But I will tell you, especially with physicians, I was terrified of physicians. Probably when I was 23, 24, and I was just so terrified that I would say the wrong thing. And that it would affect something, and then they'd go back to my CEO and say, what is this young lady talking about? In my mind, I told myself this story of what would happen. I ended up talking with another orthopedic surgeon, and I realized that the way he showed up, whether it was frustrated or very curt, was specifically because he wanted his patient to have the best outcome. So he wasn't upset at the nurse. He was upset that the plan he had in mind for his patient was not carried out, and thus could set them back clinically.
Hard to argue that.
Hard to argue that.
That seems very consistent with all your answers, that you're looking across silos. You're looking at the ultimate impact you're trying to create on the patient for safety and for caregivers as well. You're going beyond stereotypes of, well, a physician operates like that or acts like this, and they only want this because it's a personal thing. No, you're able to see the bigger picture. How did that happen?
I think it was my dad. I think it was my dad being that kidney transplant patient, and it was hearing my mom say, "I wish the lab would stay open a little bit longer so I can run these labs before their surgery tomorrow. I wish radiology would come take this last chest x-ray because I need to process this." And the dependencies that are required across the team so that the patient doesn't get pushed back for their surgery, so they leave on time, so that when they're sitting there in this bed, like we're literally in this little 3 foot wide, maybe 6 foot long mattress.
Yeah.
Staring at a ceiling or maybe an old TV show. That's not a life any one of us wants for 4 days on end. So let's flip it. What do you all have to do? What do we have to do to get that patient some communication during the day, a hot meal, cleanliness? Like the experience for a patient is no different than what we might expect from a hotel, right? Like, or just walking into a store. It's humanity. It is basic humanity. And seeing my father be a transplant patient, being a caregiver. My grandmother lost her sight when I was in 11th grade or 12th grade. she had cared for us all her life. Like, this was not a thing. She wasn't a blind person. And all of a sudden she wakes up and she's blind. Her life literally changed within a matter of hours. And all the dependencies it takes. I don't know. What else would you focus on? Because if you focus on the bottom line, it's generated through patients. If you focus on your branding, it's the perception of patients or the perception you want with patients. Like, at the end of the day, people are still in the middle of this continuum.
That's such a beautiful set of experiences that leads to that kind of worldview. It's clear to me why a leader like you creates the kind of results you're able to create, because you come at it from the right kind of place and you come at it with an integrity of your own values. And that's very cool. Hey, last question. I know I really appreciate your time. Last question is, what's inspiring you these days? What inspires and helps educate your thinking? What are you listening to? What are you reading? Who are you talking to? What as the old Stephen Covey thing, what's sharpening your saw?
It is really multifaceted in this last year or two. It ranges from I listen to sermons because my faith grounds me, and sometimes if the sermon is good, I might listen to 3 to get caught up. Like, I remember Dad listened to 7 in a day, just back to back, because it was a long drive. Wow. But when you could encourage your soul, whatever you get your faith from, you start there, right? I'm like, cool. Okay, that's what I listen to that. I've also been listening to a lot of things about personal finance. So I think yesterday I was listening about wealth building because I have 2 small children and I want to be intentional. This goes back to the strategic part of, I would like to be putting in moves and actions now that will benefit them maybe 30, 40 years from now. My kids are 7 and 4. So it's not like they're about to go to college. I'm working on how to be a more patient mother.
Oh, cool.
With the 7-year-old and reading.
Oh, man. Oh, boy.
And actually, I'm doing a lot more networking. I am talking to a lot more healthcare administrators that I just never took the moment to pause and sit down. Like that question earlier around not go so fast. And so if someone says, hey, let's get together, we all say, let's get together. We all, it's a closing statement.
Yeah.
I will turn around and say, tell me your assistant's email address, and I will at least connect. And sometimes the connection is 3 to 4 months, but it is scheduled, it is committed, and if it shifts, then we shift. That's okay.
Yeah.
But it's there in place. And so I'm literally just sitting down talking and learning from other administrators. Like, how has your journey been? What are you working on? What are you seeing out there? And so that sharing that I probably hadn't done, I know I didn't do before because I was so driven on this particular pathway. So now I'm like faith, finance, networking. Those are some of the things I'm working on to sharpen my saw.
Oh, that's fantastic. Hey, Roberta, thank you so much for your time. I appreciate this. As I said, I'll follow up with you. I value you. I'm so happy you're a star in leadership in healthcare today, because we need all the stars we can get.
Thank you so much, Foster.
I hope you enjoyed this conversation with Roberta Tinch. Her empathy, compassion, presence, and a calling to improve the care provided to patients and families are significant factors in her success. Can you empathize with others while driving performance? Can you be present to others, even when you don't agree with them or their perspectives? Roberta teaches us that they aren't mutually exclusive. Set the table, invite cool people, magic happens. I'm grateful to Roberta Tinch for sharing her wisdom with us. Until next time, leaders, step wise.
Thank you for listening to Stepwise. Stepwise is brought to you by Dr. Foster Mobley. Edited and promoted by Zetis. You can listen to more episodes wherever you stream podcasts. Find out more at fostermobleymt.com or follow us on social media at Foster Mobley. That's FOSTERMOBLEY. We look forward to having an inspiring conversation with you soon.